Hello everyone, good evening. I'm Steve from UCAN English Tutoring. In today's session, I have invited Susan, one of my students who has recently appeared in her OET examination. She would like to share her experience with us. Let us invite her for this. Hello Susan, how are you doing?
Fine, sir. Thank you.
How was your experience, Susan, with the OET examination this time?
Yes, it was actually far better than before. This is my second attempt, so I could do it hopefully better this time with the help of your strategies, sir.
Okay, so let us start with the OET listening subtest. How did you find listening part A? Was it much better than before?
Yes, sir. Actually, it was pretty easier than before just by following the keywords and underlining the keywords. So it was very easy to follow up with. And the second text part was a mixed conversation of gynecology and psychology and everything kind of thing. So that
Okay.
was little bit it was not difficult, but it was fine actually. So yeah, the first part was perfect actually, so I hope I'll get all the marks. Yeah.
Did you miss any questions, in part A of the listening?
Missing in a sense without answering, sir?
Yes, without answering. Did you leave
No,
anything
sir.
unattended?
No, nothing
Okay.
like that.
Were you 100% confident about your answers?
Yes, mostly I'll get around 20 to 21 maximum. Confident answers are like that. I don't
Okay.
know about 3 or 4, yeah, in part
Uh,
A.
Okay. And what about part B, and how did you manage your time with part B?
Yeah, part B I could finish with 8 to 9 minutes maximum, sir. No, sorry, I was telling about part reading part B. No, listening part B was easy, sir. Yeah, it was easy. I could same with the same help of your strategies only. I could follow the keywords, and it was pretty easy by um, uh, listen reading the choices multiple times. So
Hmm.
it was easy, sir.
Wow, that's
Part
good.
B was pretty easy, yeah, than before,
Okay.
yeah.
Okay. So in part C, how did you manage your time, and were you able to find out the answers quite easily?
Part C, the first text part was little like it was vaguely like she was speaking very vague, so it was I could not follow it, but
Hmm.
not all of them, but somewhat I could manage it, yeah.
Okay, all right. And what about the speed of the overall OET listening audio files? Were they
It was
speaking at a very fast pace, okay, in part A or part B or part C?
yes, part A listening text to extract was very like it was very fast audio. The
Mm.
the
Oh my
lady
God.
speaker was talking in a different slang actually. Like I think we have uh, done it in the mock test and something like that, but
Hmm.
it was very in a fast speed actually. We couldn't
Okay.
follow it. And part
Okay.
A text extract was very like it was very clear,
Okay. So out
very
of
slow.
part A, I think you should be able to get maybe full marks for the first extract, isn't it, using my
Yes,
strategies?
I'm sure about it. I'll get 12 because it was
Okay.
very slow and very clear. He was very
Mm.
clear.
Okay, perfect. And for part C, what was the topic in both of them? Did you remember anything?
Part C first extract was no, sir. Part text 2 I could remember regarding the what is that called? Mm, no, sir. Right now I'm not remembering it. 1 second, I'll
Okay,
let you know.
that's all right. But for the first one, do you remember whether it was the interview or is it like a monologue?
No, sir. Both were monologue regarding the research study. Yeah.
Okay, so they were the research studies and they were talking about the researches, that they have been conducting, isn't it?
Yes, sir.
Okay, perfect. Yeah, no worries. And what did you do in reading part A, B, and C? How did you manage your time for part A particularly? Because many people,
Part
have been struggling to complete part A of the reading on time.
Yes, part A, topic was cardiomyopathies. There were lots of tableau columns, and the medicine were all given in the tableau columns as well as, and even the definition part of thing was divided because the according to the different types of cardiopathies, and the text were very big text, but still I could finish in 12 to 13 minutes maximum.
Wow,
And I was
12 to 30
revising the
minutes.
answers.
That is
Yes, I
amazing.
was,
That's really good. Yeah. So
yes, I
all
was
my students
revising
are
the
able to
answers.
finish, part A of the reading usually well before the time. And yeah, some of them can finish it even within 8 minutes, 10 minutes, or 12 minutes. It's just like you, and it's amazing. I'm quite happy to hear that.
Yeah,
Yes.
because last time part A reading was very big text in a small text, but there was lots of gaps. Here in this part A, it was small fonts with lots and lots of information, but still we could do it. Like yeah, we could do it, and I was revising, and I could correct the wrong answer which I was written, and I could find the correct answer in the revision. Like after that 13 minutes, within the 2 minutes, to that
Okay.
extent it was
Yeah.
easy actually. Yeah.
Yeah, I got it. Do you remember how many pages, the text were they like 2 pages long or 3 pages long in part A of the reading?
Of like 2 pages, that's what I'm telling. The fonts were very small this time.
Oh, okay.
The
I
fonts
think,
were very small. Yeah.
yeah, I think it's really hard for many students, and they have complained regarding the size of the letters that they print on the question paper as well as the textbook. They should increase the font size, isn't it?
Yeah, that's what I'm telling. The last time I wrote last year, the fonts were very big, and there was lots of gap between. But this time there are lots of information. The each text A was itself the half of the page with small fonts.
Okay, no worries. And how did you start part A? Did you start with the information matching with the text question type, or
So,
did you start with the fill in the blanks or short answer questions?
no, sir. The last one, as you taught me, like the third part of the question paper, which is from
Fill in the
15th one.
blanks. Yep.
Yeah, yeah.
Okay, perfect. All right. Yeah, that is one of the best strategies anyone can follow in order to finish their part A reading on time. So, how did you find part B of the reading subtest? Was that easy this time when compared with that of the past?
Part B was all only one was direct questions. The other were all memo and principle. What is the main idea and what is the principle suggest kind of questions. So the question was actually like better, not like how we practice. It was the choices was also not big choices. It was small choices, so it was easy to find with the keywords as you mentioned. So hopefully, yeah, I could get 5.
Perfect.
Hopefully,
Yeah,
to my knowledge,
perfect.
yeah,
Perfect. That
because
sounds really good. That sounds
we
really good.
will know, right, sir, whether it's
Mm.
correct or not. To that extent, I can say hopefully. Let's see. Yeah.
Okay, perfect. And one warning I would like to give everyone is that you need to practice the indirect questions in part B of the reading subtest more than ever before, because they may ask you the questions such as according to the memo, blah blah blah, or they'll say the memo suggests that blah blah blah, the memo highlights a point that blah blah blah. So those kinds of questions are more frequently asked these days when compared with that of the past. So please be prepared to tackle those kinds of questions in your actual examination in the future as well. All right, let's
And
go
one
on
more
to part
question
C.
reading
Yes.
is I still remember that question. It was direct question, but indirectly asked how regarding the uniform ID tag of the medical professionals.
Mhm.
It was really nice question actually. It is tied around the neck, whether they should remove it or they should put it. But in the text, it was mentioned that the ID card should not touch the any of the medical instruments or something like that. But in the question it was asked whether it should be on the neck or not. So answer is we have to remove when we are not around the clinical premises. So that was
Okay.
the answer, but in the text it was totally different text, but it's
Yeah.
a direct question.
I
So it
understand.
was difficult to actually answer that question. That was the one thing I took it long time, but I could find it because the
Okay.
neck was the main keyword of that question. So it was actually a very tricky question.
Yes, please. Yeah, that will be much better. And yes, so please remember that these days it's quite common for the examiners to design the indirect questions in both part B as well as in part C. So please be prepared for that, and we will go through those things maybe more and more. And I'm also planning to take these things into account. I will try to prepare some new materials based on whatever the feedback that you have got. This is one of the main reasons why I would like to conduct these kinds of events, so that I can strengthen the difficulty level of my question paper, so that the students will get more benefits and they will be able to pass their actual examination as well, because they are going to practice similar kinds of difficulty question papers anyway. So how did you manage your time in part B and part C? Because there are only 45 minutes, but many people struggle to finish part B and part C on time. So what did you do in those two
No,
parts?
sir. Actually, I was practicing while practicing itself each part. Like, for example, part A 15 minutes, part B 15 minutes, part C first takes 15 minutes, and the second extract is 15 minutes. I used to practice like that at home even. So, exactly before 2 minutes, yeah, I finished the whole 45 minutes of the part B and part C. It because I was trained like that, right? So, it was done, even though it was difficult, but the time I could finish. So later I was checking whether it's correct or not. So uh, it was like that. So I
That's
didn't
really
keep
amazing.
the whole 45 minutes. I didn't keep for part B and part C. I split it into 15, 15, 15. So that was easy for me to
Wow,
do
that's
it there
amazing.
also. On the
That's
weekend.
amazing. Actually, time management is one of the key factors that you have to face. So when you do the practice test, in the beginning, you don't need to worry about the time. Okay, you can take your time and you can try to find out the answers using the strategies I'm gonna start teaching you. But once you start practicing, let's say maybe for a week or so, or if you have got the examination booked in 2 weeks or 3 weeks or in a month, it's better to start managing the time by setting up the alarms on your mobile phone and following the time. That will definitely help you out to boost your confidence levels. If you can get really good scores in my practice materials, trust me, your actual OET examination is going to be really easier than you think of. So what is your opinion regarding the materials I have prepared for OET listening and reading subtests, Susan? So what do you think about the practice test materials that I have prepared for listening and reading? Were they very helpful for you in the actual examination, Susan?
Yes, it was really helpful because what I felt was part A and part B was much easier than your materials because I could follow it in a easier way. Find it in a easier way rather than the uh, your materials because it was already difficult. So this one was because your materials had bigger choices. So this was with like 5 words, 7 words maximum in a sentence. Part B, the choices I'm telling. Yeah.
Okay, yeah, perfect. Yeah. See, I would like to ensure that I prepare you for the worst situation. So if the questions have got the maximum difficulty levels, you shouldn't be struggling there. You should be able to ace them like a champion. And that's what I'm doing. And I'm happy to see that you are already showing positive experience, towards the examination. Okay, let's jump on to the writing subtest. What did you do in writing? Did you manage your time? Were you able to get some time to plan your letter, write it, and proofread it as well?
Yes, 5 minutes, as everyone knows it. 30 minutes I could finish it because it was an update letter, and then I finished in 30 minutes. So I had remaining 35, yeah, 10 minutes to 7 to 8 minutes to just proofread, and I could manage it. It was an update letter for a 4-year-old boy
Mm-hmm.
uh, with to the family GP doctor. So
So
it was
that
just,
was a known case, isn't it?
yes, it was a known case. So the purpose was like you have to update to the family doctor. So I could do that. and just the present day complaints only has to be written, because it was only very, very minimal information was given in the case notes, like
Yep.
what was the, can I tell the full case notes, or
Yes, of course. Yeah, if you wish. Yeah, that would be great. Thank you.
the date was already mentioned actually, and the
Mm-hmm.
mother got the son through the kindergarten teachers to the
Okay.
maternal nurse.
Okay.
That particular day was 8th of January 2023. Yeah, 8th of January
Okay.
2023. The nurse is writing her assessment. The gross
Mm-hmm.
and the growth and development were normal,
Yep.
and her assessment was he was not talking properly.
Mm-hmm.
There were no verbal development, and
Okay.
his hearing impairment was also there. And yeah, and the mother was telling that they didn't follow it properly because they thought that they could catch up later. All these
Okay.
words were there,
Okay.
and then the past medical history was all the he had recurrent ear infection. They were the GP doctor advised for a surgery, but the mother was reluctant to do the surgery. All these
Okay.
things were mentioned, and
Okay.
for that particular day's visit, they have mentioned that hearing impairment. In the bracket, they were mentioned recurrent ear infections.
Okay.
So, uh, so so it was like, I mentioned like it was known that he had recurrent ear infections, like
Yep.
that I mentioned, so that
Yep.
his hearing impairment was
Yep.
kindly check hearing impairment due to recurrent ear infections, like that I
Okay.
mentioned.
Yep. Perfect.
So
Yep.
yeah,
So you
that's it.
need to refer, yeah, you need to write down the referral, to his own GP for the management
Yes,
for intellectual impairment, developmental
yes,
impairment, and hearing impairment, isn't it? So you
yes,
got to
yeah.
include all those things and request them. Okay, perfect. And then what was the name of the patient? Sorry.
Leroy Leroy Tran,
Tran. Okay, Leroy Tran.
Leroy. Yeah,
Okay, perfect. Yes. All right. So this was the known case. Yeah. So it's good. So it was the family GP. So did you exclude the social background and the
yes.
previous medical history? I mean, apart from the ones that recently occurred, were you able to
Everything I
exclude everything
excluded.
else?
Nothing was
Okay.
written.
Okay. Perfect.
Just I mentioned the ear infections, which is already known to you. Like I
Mm.
just added that one particular word. That's it.
Okay. Perfect. Yep. No, no worries. And did you get some time to proofread your letter and were you able to find
Yes,
out
I
some
got
mistakes?
all it 8 to 10 minutes. 8 to 10 minutes, I got it actually. Yeah.
Okay. Did you rectify any mistakes while you proofread
Yes,
the letter?
I erased some of the sentences and I could do it again. Yeah.
Okay. Did you verify the letter against the usual mistakes that you commit?
Yes, I was putting some spelling mistakes for this, like understand and all. I just I didn't put
Okay.
D, I didn't put N, something like
Okay.
that.
Yeah.
Right?
Right.
So
Mm.
I was just erasing it and I was doing it. Yeah.
Okay. But are you happy this time when compared with your performance in your previous exams, particularly for the writing, reading and listening?
Yes. Hopefully it should be better. So praying for
Okay.
that.
Yes, definitely. Yeah, I also wish, will pray for your results. And let us jump on to the speaking. And you said that you were the first student for the speaking role play, isn't it?
Yes,
Were you
12:30
nervous?
exam finished and one
Ve-
o'clock. No, sir, nothing. I could feel anything because I was numb actually,
Mm,
and it was a European interlocutor. So she
okay.
was actually very, very cool, and
Yep.
by God's grace, yeah. And
Okay.
it was the first role play was no the what is that called, the warm up questions was how was your typical day and why did you choose nursing?
Yep.
I just told something, and
Mhm.
the first role play was the 4-year-old boy got admitted in the emergency department, and he has tibia collarbone fracture, who is
Okay.
for the count, and he's already using crutches.
Okay.
So the mother knows about the crutch care, but still
Yep.
you have to emphasize on both together. It was 4 tasks
Okay.
by
4
giving how.
subtasks. Yep. Okay. That's amazing.
Yes.
I think
Yeah.
recently one of the students, in the previous examination have reported me that they have got so many subtasks in the OET role play conversation. But in your case, it was only 4, which is really good. I'm very happy with that. Was this patient cooperative or not? I mean, the
Yes, the
interlocutor.
first role part, the mother was very cooperative, sir.
Okay. All right.
But the
Perfect.
second one was the hospital ward for a 75-year-old man with pneumonia who's
Okay.
on IV antibiotics.
Yep.
He needs discharge and the IV to be converted to the oral antibiotics, which is the patient was very annoyed and going on asking so many questions. Like he was very arrogant
Okay.
and something like that. So the four subtask, he was so angry. So we should always emphasize on it's okay, I understand, like that. So
Yes.
it was four subtask only, sir,
Four
but not
subtasks. Good.
of information giving, just changing from IV antibiotics to oral. And regarding the discharge, we have to convince him and inform the doctors and the medical team according to his progress. To that subtask, we have to inform him. That was a subtask actually.
Okay.
Yeah.
Perfect. Yeah. So my suggestion to the people who are listening to me on my YouTube channel, as well as the students, who are here, I wish you to practice, the ones which have got less number of subtasks, as well as the ones which has got more subtasks, let's say 8 subtasks or 9 subtasks, because this will help you to boost your confidence levels, and you can certainly ace the real OET speaking subtest, because you have been already practicing, both of them, right? So it's going to be very helpful for you. So don't just be hesitant, to practice these two kinds of role play cards. Okay. And were you able to complete all the subtasks on time, Susan?
Yes, the thing is that she didn't tell me to stop, but I could finish all the subtask and summarize it. I didn't follow the time, but she didn't tell me to stop. So that was the only thing I was thinking about it later, whether I finished earlier before 5 minutes or
Yeah,
that's it.
5 minutes is the is the advised time, but it doesn't mean that you have to finish only in 5 minutes. You can also finish in a bit early as well, as long as you cover all the subtasks and you showcase the sympathy and address the patient's concerns, and if everything seems to be good enough, you can finish it in about 4 minutes and 30 seconds itself. Okay, so you should not be worried regarding that. So what things, okay, overall, you would like to share with the students that they need to be really careful about? For example, you might have been feeling that you should have done something better, in this particular area or in this particular question type. So which couple of things, would you like to share with everyone watching this video?
Yes, I will recommend that regarding the reading text, let's not choose always the disease conditions. Most of the text was regarding the research part of you only. So the reading part C text was the congenital disorder, uh, which is on the research part also. So it's better to uh, uh, get all those kind of texts instead of just going only the uh, disease conditions part of text. So that
Yes.
would be better for us to practice.
Okay, so in part C of the reading, we need to practice more and more on the research discoveries and findings. Okay, so
Yes.
I keep this in mind, and then I will try to prepare some more materials regarding this sooner for everyone to get more benefits on that. And yeah, do you have any other suggestions for the viewers?
Uh, And regarding the reading practice again, so it's better to practice like even for the part B, C, 1, 2, let's practice 15 minutes time. So it is easier for to go and manage the time in the main, so that we know how we can manage time, like how we manage time in part B.
Okay, perfect. Yeah, sounds good. And which two things do you think you have done a wonderful job in your OET examination? Then
I would
in the
definitely
past,
say
then the past.
part A, sir. I would definitely say part A in reading and in writing, because writing previously, you know me as you were correcting my things. I
Mm.
could definitely say writing and reading part A was awesome. I'm pretty confident in this time in part A reading and listening part A also.
And what is your feedback regarding my coaching, especially on the writing, reading, listening, and speaking? What did you find?
To be honest with you, sir, we were like, I was really thirsty of getting 300 in your corrections, but I never got that, I know. But still, but this time, the main exam, I will definitely cross 300. I'm sure about it.
Yes, definitely.
And
See,
because the corrections are like, it's literally very, very useful, because the commas, the full stops, the spelling mistakes, everything we are aware of it.
yeah.
And regarding the reference and the dates where we have to write the salutation, everything was clear for us this time.
Mm.
And reading part A, time management, and how we have to find the answers, everything was really, really very helpful personally to me, sir.
Oh, thank you so much for your feedback. The people who are watching this video, please be confident. You can definitely make it through. Okay, I'm pretty sure that Susan is going to win this battle with the OET examiners this time, and she is going to write a history, okay, in her life. And I'm pretty sure that if she can do, everyone can do. Trust me, you can do. I thank you so much, Susan, for coming here and sharing your work experience with us. And I'm pretty sure you should be able to pass your OET examination this time. I wish you all the very best for your results, and I will keep you in my prayers as well. I'm pretty sure you are going to smash the OET examination this time and get more than what you were aiming at. All the very
Thank you so
best.
much. Wishing all the very best for all the students. Kindly follow his strategies, especially in reading and writing. It's really helpful, and for the speaking also. Thank you
Thank,
so much, sir. Thank you.
thank
All
you.
the best for all the students. Yeah.
Thank you.